we're going to talk about migraine treatment. We're going to talk about migraine treatment. Like, what do you do for migraine? How do we treat migraine? If you suffer from migraine, what do we do in acupuncture or Western medicines? Okay, so you need to know this. Well, one of my platforms is not working. I'm not quite sure why. Let's start it again. So today's topic is migraine treatments. So we're gonna introduce in Western medicine, what do they use, what do they do, and they recommend, and as well as acupuncture, and Chinese herbs too. And what happened is tomorrow we're gonna introduce what can you do at home, which is acupressure point. We're gonna introduce the acupressure point tomorrow for migraine. Now, if you're on this video, please give me a thumbs up, and as well as take your friend, your family into this live video, and to let them know that I'm here to share. Thank you. You're on this, waiting for you, and if you come up, you say hello to me, and I want to know where you're from. Are you an acupuncturist or are you a patient? You're not an acupuncturist. Do you know anyone who suffers from migraine? If you do, please tag the name in, tag them into this live video. Okay, we're going to talk about the treatment of migraine. Okay, what do you do with migraine? What treatment do we normally give to migraine? Okay, then okay, let's start straight away. Well, we start with live video. Treatment, migraine treatment. So migraine can't be cured. We know that. Okay, we talk about this according to modern medicines. Migraine you can't cure because we don't know the real reason of migraine. Okay, but we know the things that trigger migraine. So if we can avoid the trigger, if we can avoid the factor of the trigger, then if we can avoid migraine. Right? Now, therefore, we're talking about how we can help you to manage migraine, so you get them less often, or when it happens, we treat the symptoms. Okay, we treat the symptom. And in our clinic, we found that some people come and they say they have migraine previously, they were little when they're young, but as they go, the migraine disappears. And migraine can go away for years and then come back again. Now, and they don't know, a lot of patients, they didn't know why the migraine just disappeared, you know, and then it suddenly appear again. All right, so we need to find out the trigger. We talked about it yesterday. Now, so we need a plan. So the plan will be very different according to your age, how often you have migraines, the type of migraines you have, and how severe. Yeah, we're gonna talk about different type of migraine as well. Okay, probably tomorrow. Tomorrow we're gonna talk about if we talk about what can you do at home for migraine. Then we want to talk about what type of migraine are you suffering, yeah. Or if we talk about what type of migraine tomorrow, then we'll put the what can you do for migraine on the next day after tomorrow. So the type of migraine you have and how severe they are based on how long they last and how much pain you have and how often you keep you from going to school or work. Yeah, migraine interfere with your work, interfere with your life. That is why we need to keep it in control. That's why we needed to stop it. Okay. Whether they include nausea or vomiting, as well as other symptoms. Now, they include what? Light issues, dizziness, vomiting, nausea. All these symptoms are terrible. And fatigue, how do we manage those? Okay, then the plan is all included. Other health conditions you may have and other medication you may take. Are there any medication that you're taking? Any of them that will cause migraine? What is it? Hormone therapy, contraception pill. The drugs of contraception, it often cause migraine and headache. Okay. Your treatment plan may include a combination of this. Okay, self-care migraine remedies, which is home care program. I will show you how to do that, and I'll show you what we suggest our patient to do at home. Okay. Lifestyle adjustment, like including what we call about changing your life, managing your life better. It's one of them is we call emotional daily practice, which is stress management, and avoid migraine trigger. If the bright light is shooting on you and you get migraine, or if you have alcohol, you get migraine, then you have to avoid them. You have to figure out all this. Like you can get some painkiller that over counter. You don't need a prescription for that. Right? So what prescription and what drugs can you get over the counter, not from the doctor, and what side effects will you get? So those drugs normally is Tylenol or aspirin, and Nurofen. All these drugs is NSAID drug. You can take it over counter, but you need to know when you take it what would happen. What is your expectation? And we're going to discuss it later on. Prescription migraine medication that you take every day to help prevent migraine and reduce how often you have headaches. Okay. Some of the prescription from doctor, the migraine medication. Okay, so what are they, and what do you expect of them? Do you need to take it every day, or just whenever it happened, before it happened, then you take it? So there are clear instruction, and again, you need to take it and try it yourself. Okay, it may not work, it may work. So we don't know, not until you try it yourself. Right? Hi, good morning. I see that from America here. Good morning, Szenan. Thank you for giving us your precise time. Thank you. Nida, how are you? Thank you for joining us. Thank you. Okay, let's keep going. Now, any of you suffer from migraine, you can let me know, because I want to know. I will know more about you. And any of your family suffer from migraine. If you do have family suffer from migraine, you want to tag them into this live video. So on Facebook, you can tag them in. Now, or any patient, don't tag your patient in. Or if you have your patient Facebook, yes, you can tag them in. Okay, so they can have a good idea what migraines is, how can they prevent it, and what acupuncture. We're going to talk about acupuncture point today. How you needle it. I'll give you a strategy, magical 12 strategy. Okay, I'm going to name the point for you, but yeah, we're going to show you some acupressure point, but not today. Acupressure point for other days. So the acupressure point and strategy and the magical 12 strategy is different. Okay, because magical 12 patient can't do it themselves. It's 12 points. It's too difficult for them. You know, at some point it won't reach it properly. So magical 12 strategy today is for practitioner. I know that a lot of practitioners watching this video, and I also put this live on my clinic Facebook page as well and Instagram. So I also want my patient to learn. So I will provide a home program of acupressure point. Then, but we're gonna talk it tomorrow or the day after tomorrow. I want to give you all the strategy. Point of the strategy. Okay, hormone therapy. Hormone therapy is migraines seem to occur in your menstrual cycle. Okay, we use that. The doctor will give you hormone therapy if the migraine triggered by the menopause and menopause and period bleeding. Yeah, pregnancy. If you're pregnant and you get migraine, and they don't normally take drugs for it. So it's funny, isn't it? Why is that? Some do though. They take some medication. They can't bear pain, but a lot of them they won't take anything, and they come for acupuncture when they're pregnant, when they have migraine, because the hormone change, the estrogen and the progesterone level change, and it causing the migraine. The reason they don't want to take the medication, the painkiller, is because they don't want the side effect of the medication that affect the babies in the pregnancy. Okay. All right. Counseling. Yeah. If it's stress related, counseling may work. Okay. If it's not, then counseling probably difficult to help. But anyway, in migraine, that a lot of people actually have problem with stress. Stress is the biggest one that to trigger migraine. It is. Now, I think that we talk about all this is pretty common. Okay, then people will say there's alternative care, which means if they are not working, that people will consider about acupressure point, meditation, acupuncture. But I actually would suggest people come for acupuncture and acupressure point and do more meditation if meditation help. You know, why doing this better than drugs? Because they have no side effects. Would you press acupressure point and give you side effects? No, it won't. They only get you better. They 100% get you better. Or there's no effect on you, but it won't give you side effects. Okay, so this, when people talk about alternative care, this alternative care should be put in first. Whoever have migraine, you should try acupuncture and acupressure and meditation first, because they won't give you any side effects. You see, they won't give you any side effects at all. Okay. Now, other than what we just talking about, how you can manage it when it happens. Okay, there's few things at home that you can manage it. Yes, acupressure, we're going to talk about it tomorrow or the day after tomorrow. Normally, because they're quite sensitive to the light, and so they lay down is better than sitting or standing. Lay down, quiet. Why quiet? Sensitive to sound, very sensitive to sound. And on a dark room, why dark room? Because sensitive to the light. You know, in daytime, during the day, it's quite bright. Close the curtain, turn off the light on a dark room, and have peace rays resting in there, and it will help. It will help settle it down. Okay. And of course, massage. Massage the head. Massage the head. Okay, it will help. But you need to know where to massage it. Okay. And how do you know? Give it a go. Just give it a go. Just tap like this, you know, just tap your head or just do this. Now, in some cases, it does help a lot. In some cases, it actually make it worse. You can't put any pressure on the head, so don't do that. So how do you know? Try it straight away. Ask your patient. If you suffer from it, go ahead and give yourself massage. If there's no people around you, just give us. But I will tell you, you massage it, you feel better. Very quick, it come back again. I've tried for patients. So sometimes the massage over here, it can help a lot. Some it just as soon as you massage, you feel good, and then you stop, gradually come back again. That's how we expect it. But yeah, giving some relief, it will help. If you feel cold, or you put a cold pack on it, so cold cloth on the forehead or on the neck, it may help too. And try it. And a lot of people have it, and it helps. It really helps. Okay. Let's talk about medication, because this is more often that migraine patients get this, get the medication for migraine. That more often, okay, very, very often. How did you treat your stiff neck that caused migraine? Good idea. You can put it in here needle. Okay. Now in medical 12 later, we will talk about medical 12 strategy. I'll give you the point. I'll let you know in the medical 12, and then you can treat the migraine as well as the neck problem. Okay, 12 needles strategy. I'll let you know later. Veronica, thank you for very good question, and I love it. Medication. Okay, medication can be used in either prevent a migraine from happening or treat it once it's happening. Okay, you may be able to get relief with the medication that over the counter, you know, like NSAIDs drugs. But however, if the over the counter medication ineffective, then your GP, your medical doctor may decide to prescribe other medication. Okay. Now, this options it will based on your how severe is your migraine, you know, and are there any other health conditions? Because if there are any other health condition, because the prescription they may give you to prevent the treatment, it may have a very strong side effects. So it does need to consider whether you have any other health issue. If you have a kidney failure issues, or you have a liver problem, function problem, they probably won't give you any prescription drugs, because most of the time those drugs are strong, and some of them, when you take it, you have to take a regularly test of your liver and kidney functions. It may suggest that every 3 months or even every month take a blood test and see whether make any change in your blood test of your liver function and kidney function. If you get the side effect of them, they won't give you. They will stop your drugs. Okay, that's how it is. Now let's talk about what the over-counter drugs. What are the over-counter drugs? The first one is aspirin. You know, people get headache, migraine, they take aspirin. Right? It works. It works. It did work, but not for everyone. And when it works, people try to rely on it. You know, I take a little bit every day. Now we know aspirin is thinning the blood and it has a very good effect for it's an anti-inflammation drug, you know. So it can decrease inflammation. So what is the side effect? I will tell you all the drugs and all the painkiller drugs. They have the similar side effect that harming your stomach and spleen. Okay, so aspirin, for example, you may get severe nausea and vomiting and stomach pain. Hey, migraine causes vomit and nausea, so it confused. When you take the drugs, you feel a bit better in the head, but vomiting and nausea sensation still there. That feeling still there, or it make it worse. And you don't want this. You don't want this. What is the best place for it? Acupressure point. We'll show you later on. Not today, tomorrow. Then it may cause stomach bleeding though, but that is when they take it for a long time. And not normally happen stomach bleeding if you take 1-2 days or a week. I haven't heard of people have this just 1 or 2 days and they get, you know, maybe I'm not practiced long enough to hear that. But I do heard from people that over 20 years, 30 years of medication, and one of them is aspirin, and they get stomach bleeding, and that's not good. And ringing sound in your ear, confusion, rapid breathing, seizures. That is kidney problem. Kidney control the ear, kidney control the brain, the heart control the brain too. From the side effect, come back to the TCM theory, traditional Chinese medicine theory. We know how the drugs affect the organs. You don't have to take it. You just see it, look at the symptoms, look at the side effect, and then you know it will happen. Okay, it harm what organs? Okay, people take aspirin for fever, but it can give you fever too. Then it will give you a rebound pain, rebound headaches afterward too. Okay, that's common. We will talk about rebound pain later on. Rebound headache. Okay. Then the second drug is ibuprofen, over-counter one. And in New Zealand, if you go to Countdown, we have Countdown here. It's our ibuprofen. Everyone can get it. Okay, so funny enough is like, hang on, yes, it can give you stomach problem as well. Stomach pain, bloating with ibuprofen. Okay, and the funny thing is, one of the side effects of ibuprofen is headache and dizziness. And how do you know if you take it and you still get it? It may be caused from side effects, isn't it? It may cause from side effects, and you don't know. You try to use this to treat the headache and dizziness, but it actually give you, it cause headache and dizziness. It's funny, isn't it? It's funny, and it make you fatigue, restless, and sleep, and you want to have a sleep, but it make you restless. Yeah, thirsty and sweaty, tingling and numbness in your hands and feet, fluid retention and swelling, ankle swelling, same as aspirin. We talk about nausea, vomiting, heartburn, diarrhea, and constipation, or constipation, abdominal pain, and you can even get bladder irritation and frequent urination. Urine, who control urine? Kidney and bladder, right? So it can harm the kidney and bladder. Dizziness, so version, blood version, eyes irritation. Who control those? Liver, So we don't have to rely on the test to get your liver function, to see what this drugs has effect, and have you got side effect in your liver function or not. No, we look at by the symptom. We know when there is stomach pain, vomiting, diarrhea, constipation, we know it harm your stomach and spleen. And when it give you frequent urination, we know it harm your kidney. When it give you dizziness and it give you a vision problem, blurry eyes, your vision is problem, then we know it harm your liver and gallbladder. That's it. That's how Chinese medicine, looking the symptoms, we can go into what organs related to it, and we know what organs actually suffer from the side effects. Another common drugs, norepinephrine. Okay, norepinephrine has a side effect of, again, stomach and spleen, heartburn, stomach pain, nausea, and indigestive. And again, it gives the same side effect as ibuprofen, headache, dizziness. And it got others say swelling, food retention. Quite similar, isn't it? And ringing sound in your ear, same as aspirin. What? Kidney. And this have a lung issue. It can attack the lung. How do we know? Because according to Chinese medicine, lung control skin, so it may give you itchy and rashes on your body. So we know it affect your lung. Okay. So you may not be able to take it if you have asthma, and liver and kidney disease, and fluid retention, or heart attack, stroke, or blood clots. So if you have to be cautioned if you have a blood clot issue, which means this drugs actually will form blood clot. That's simple, right? It didn't tell you that it can form blood clots, but it tell you that if you have blood clot issue, you can't take this. Now, asking yourself, ask the question: if I have blood clot problem, heart attack, or stroke, I can't take norepinephrine, right? Which means norepinephrine will cause blood clot issue. Simple, very simple, right? Okay, these are the drugs that you shouldn't take. Then one of the prescription that's normally prescribed for migraine patient, or you can get it from the doctor. You can't get it over the counter. It's called Tylenol. Tylenol has the same side effects, or pretty much the same, but not entirely the same, but pretty much the same of everything that ibuprofen, aspirin have. What is it? Stomach and spleen problem, nausea, stomach pain. Now, if you have patients who are on painkiller, you need to ask them all the stomach questions. Find out whether they have any side effect of that, and you want to warn them. Bring the awareness. Bring the awareness for them, because a lot of them, they didn't know that. They take it for a while and they start to have stomach pain, bloating, blah blah blah, and they go to the doctor, and the doctor didn't feel anything because you have been taking the painkiller for years and you have no side effects, and they just assume that the side effect won't come after 10 years, 20 years. No, that is very, very wrong. The side effect may not happen straight away in 1 or 2 months, 1 or 2 weeks, 1 or 2 days, but it can come after 1 or 2 years or 20 years, 30 years. That's what it causing the patient have more and more medication because they keep covering, use more drugs to cover all the side effects. Then once they have stomach bleeding, they have to stop all the drugs. They have to start all again, all over again. Our tyranno side effects: skin rashes, stomach pain, nausea, loss of appetite, itchy in the skin again, headache, dark urine, clear color stool. Similar, right? Similar to it's a combined side effect symptoms of aspirin, ibuprofen, naproxen. So as an acupuncturist, Chinese medicine, herbalist, Chinese doctor, we miss a lot of these side effect things. And even a doctor in US, you can get over the counter. Yeah. What are you saying? Tylenol you can get over the counter, but in here you can't. Tylenol, I know ibuprofen you can get it over counter, and aspirin very common. Naproxen, I think you can get it over counter as well. Yeah. Wow. Okay. Tylenol you can get it over counter in US. Okay, I didn't know that because I haven't been to US. I'm not an American. I live in New Zealand. Okay. I know in China because we're in China. Tylenol you have to get a prescription from a doctor. Yeah. You can't get it over the counter. Yeah. It's not a common drug for it. But yeah, now you know Tylenol is much stronger. It actually has a combination of all side effects of aspirin, ibuprofen, and naproxen. So, as an acupuncturist and or a Chinese practitioner, we need to understand all these drugs, because one of my doing in my clinic is I'm trying to reduce medication for my patient and stop medication for my patient, because I found that a lot of symptoms is from the side effects of drugs, and a lot of people didn't realize that. Not until I bring the awareness for my patient. So therefore, we need to understand all the drugs of the side effects. And I don't know all the drug side effects, to be honest. As I go, I learn. And you pick up. And how do you know? Google it. Simple. Whatever patient tell you patient write down what they eat, taking the drugs. And I just Google it. I sometimes Google in front of patient. There's no shame of them, because I can't remember all the side effects of drugs. I say, well, you taking this drug, right? And I know this drug have blah, 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 blah side effects, and I straight away tell patient, because I know them, it's in my mind now. Okay. But anything that they come new to me, or I can't remember all this, obviously I don't remember all step by step every of them. So I Google, I said, well, let's check what side effect do this drugs have. I Google and put it in front of my patient. Look at it. This is the side effect. And now you have this. And I tell them, do you have this symptom before you take this drug or after? If it's before, okay, no, this is not from the side effect. It may not be from the side effect. It may still be from the side effects. Yeah, if it's after, and I'll tell you, hey, we need to suspect this condition, this new condition that you say that you didn't have it before and now you have it, or you start to take this drug and you have it right now, and we suspect that it's from the drugs. And again, as an acupuncturist in here, we're not allowed to stop any medication of the patient. We bring the awareness and we ask the patient, go back to your doctor and discuss the side effect of the drugs. You know, you have to discuss with who give you the prescription, because the doctor need that. The doctor need it. And I found some doctors very, very good, and they found out the side effect and tell the patient, don't take this because they have the side effects of the, so we'll change the drugs for you. You know, and the doctor is pretty good. But I will tell you, most of the patients' doctor, even then, they didn't realize that how bad is the side effect, and they didn't realize until I bring this up to patient, and the patient go back to the doctor and talk about side effects. What did the doctor do? The doctor just keep changing the herb, the drugs, and give them a new medication for them in general. Okay, but again, some doctor pick it up themselves, and they don't actually, they change the medication for patient to avoid the side effects. Okay, I'm not judging this Western doctor. Some of them pretty good, and I love them. I work with them. I'm just bringing the awareness, and this is how I do, and I just sharing that something that you should look at, because this part miss just about most of, not all, most of the acupuncturists and Chinese practitioners miss the side effect of drugs. They just too focused on the acupuncture and Chinese medicines, you know, try to help patient, but we can see the improving, but we didn't get to the end. And I want to tell you, one of the biggest problem is because if the symptoms is from the drugs, no matter how good you are, no matter how strong is your medicate Chinese herb, and how best is your acupuncture strategy, you can't heal your patient properly. You can't get rid of the symptom completely because they're still on the drugs. Yes, you can reduce the symptom. You can subside the symptom by treating them using acupuncture and Chinese. And yes, you can do that, no problem at all. But you can't get it. You can't complete the mission. Yeah, honestly. Okay, now there is a symptom we call overuse headache. Oh, sorry, which is called medication overuse headache, which is as known as rebound headache. Now you need to know about rebound headache. What is a rebound headache? It's medication, painkiller. So people have headache or any pain or migraine, they take medication. We talk about side effect, right? And we talk about medication right now. If you really take it, well, it's good. You get symptom relief of your headaches. But afterward, you get rebound headache. That's why a lot of patients, they choose not to take anything. I have patients when they have migraine, they says, I better just go to sleep and turn off everything, not go to work, and let it go. Let it go. 1 or 2 days in bed, you know, unless eating and going to the toilet, they get out of bed. Otherwise, they just stay in bed the whole time. Just let it pass. If unfortunately it can't pass, it will up to 1 week or 2 weeks. And I think those patients, they normally take medication anyway, or they come to acupuncture. And that comes to importance of the acupressure Why is that? Because a lot of patients, they can't, it's too severe, they can't drive to your clinic and no one around them, and they can't drive to the clinic for acupuncture. And therefore, the acupressure point is come to important for them to work on first and they get with some relief first. Then they can drive to your clinic and to have some acupuncture done for them or take some Chinese herbs. So rebound headache is when you deal with migraine headaches, you take the medication over the counter or like ibuprofen, aspirin, or naproxen, or Tylenol, that prescription the doctor gave you. You take it, you feel better, you get it off, and then you get a second time of headache, and that happened. And how serious is the second time of headache? We don't know. It may be very painful, it may be just mild, then you know this is a rebound headache. And often happen for patients. Okay, what other things the doctor will tell or suggest? Okay, if all the drugs are not working and it's still very severe, if you try all the drugs, then you can't get rid of the migraine. Then what happened? I would strongly suggest you try acupuncture and acupressure point and do the home program, meditation, find out the trigger, what trigger it, okay, and acupuncture treatment regularly, and we successfully stop migraine drugs for a patient and stop the migraine. Okay, and it works very well. And I think I would do a case study of the Monday one. We'll do one for case study. For the Monday one, we're gonna do one for migraine, because I have a case that came the year before, I think 2018. Yeah, 2018 I started to treat her and we discharged her in 2019 or beginning of 2020. I can't remember, I had to check. And this patient who suffered from migraine had a symptom very similar to stroke, very similar to stroke, and off work for 6 months, half year, and every day just get headache, constantly headache, and not speaking very well. And she speak very slow, and she will sometimes what the word in her mind, she can't express it very well. And we successfully reduce the medication, stop all the medication, and bring her to work and function again. And now she's on no drugs and back to work, no problem. And now she come back and she's taking Chinese medicine every day. I give her 200 grams and just 1 teaspoon a day, small teaspoon, and that can last for 3 months. 3 months. 3 months daily and last for 3 months. Not because she had migraine, it's because she needs to clear up according to Chinese medicine diagnosis. The pulse is not perfect yet, but there's no symptom, pretty stable. So we discharge her and come for 3 months. Not completely discharged, just temporary discharge her, come back in 3 months. So this is a very valuable case, and I would like to share it one day. Okay, now so if anything doesn't work, that the doctor suggests surgery, and this surgery is, it's unclear. They still experience. Okay, they do a surgeon insert the electric things that into the skin, and then on the live video, do you want me to burn, the nerve? Okay, I'm not very familiar in this part. I just know that they can do surgery and they can burn off the nerve. I'm not quite sure about this part. Okay, I just bring that that surgery can done for that, but they are still trying do the research and study. And some people do that. Okay, but the best thing for us to do as an acupuncturist, we do acupuncture, and we successfully help migraine patient, bring them to normal. Okay, but some of them again is the trigger. I have successful case, but it doesn't mean I can treat all migraine. I'm still in the stage. Every case is different. We help them to figure out what's the trigger, then we stop the trigger, and we help them to we encourage them to do meditation if meditation help. We encourage them to do yoga if yoga help them. We need to find out a solution that can peace their mind, de-stress them. Okay, if they have their own strategy for that, then a lot of people will do it for the start and then they stop because life is busy, and we encourage them, keep reminding them to do it every day, because that is the best way to prevent migraine. And we need to figure out what food trigger. When it comes to treatment, you need to figure out what food that trigger those. We talk about probably MSG, probably some food that is very sensitive to them when they take it, very caffeine or alcohol. Just stop them, don't take them. Okay, this is very important. So this is all including our treatment. So treating migraine, you need to know what trigger that is the main part, then the acupuncture. Now we're going to talk acupuncture now. Let's talk about acupuncture point. Now we use what we call it magical 12. Magical 12. Okay, here you go. Can you all see this main? I'm pretty sure if I put it on my face, then you can see this, right? Everybody can see it, right? Okay. I want to use this to show you the acupressure point. Acupuncture point. Now we're not talking about acupressure today. Now acupressure point, I have other strategy, because this strategy is mainly for acupuncture practitioner, and we're going to show you some acupressure point that is for patient. They can work for themselves at home, because this is mainly for needle. Some of the point is difficult for patient to practice, and you want to show the patient the easier acupressure point, easy to remember, easy to work on, and not so many. It's just few of the points that patient can work on. And you don't want to be like 3 points. That's the best for patient. You don't an area and easy to work with. This is my suggestion. And this point, just keep it for practitioner. Okay. If we do, like, what is magical 12? Magical 12 is 3 in, 3 yang, 3 in, 3 yang. This is how you do. You put 3 in, needle 3 in, 3 yang, 3 in, 3 yang. Or you can do 3 in and here, either go here or go here. 3 in, 3 yang, 3 in, 3 yang. Okay, again, 3 in here, 3 yang, 3 in, 3 yang. Okay, you can start it on here, you can start it in here as well. 3 in, 3 yang, 3 in, 3 yang. Or this is what we're doing, right? You can do it here, 3 in, 3 yang, 3 in, 3 yang. You see the difference? You can in yang, go in this circle, or in yang, go in this circle. Doesn't matter. Okay, now you find it, the magical 12, we're doing the image. Okay, the image. the headache, how can we image the headache? You can just needle in here on the palm, from here to the wrist. Okay, what's the wrist? Wrist represent neck. Okay, wrist represent neck. Okay. Now this is what we're going to do. We do 3 in and here on the leg. Spleen 1, liver 1, kidney 1. All Jingwao point, right? Then next, we go to here, the hand. 3 yang, level 3, large intestine 3, Sanjiao 3, and Sanjiao 3 and small intestine 3. Small intestine 3. And come to here. Then you can do lung 8, PC 6, or heart 5, right? Apart from that, you can do heart, what do you call this, Szenan? Change all the 3 in meridian on the wrist, the point of the wrist, instead of lung 8, PC 6, or heart 5. Why is that? Because they target the neck as well. Okay, or you can put lung 8, PC 6, heart 5, and extra point for the neck, putting on the wrist, 3 point on the wrist, which means on here we'll put 6 needles. And it come to here, stomach 36, GB 34, and UB 40 on this day. Okay, so this is the strategy good for migraine. Okay, does it make sense here? Okay, now I have another strategy I'm going to show you. Let's repeat this strategy. Spleen 1, kidney 1, liver 1. Okay, in here. Can you do in here? Yes, you can do this and turn from that and that and that. But we start in here, right? 3 in, number 1 point, and you move to here. Liver, large intestine 3. It keeps saying liver. Large intestine 3, small intestine 3, and Sanjiao 3, right? In this hand. And you move to here. PC 6, lung 8, I make sure I did say the number wrong. I put the things in front of me because I don't know about the number. I have to look at the number. Heart 5. And over here, stomach 36, GB 34, and UB 40. Okay, this is a strategy that for headache. Now the lung 8, PC 6, and heart 5, those points can treat neck as well. But if the neck is on the scalp over here, the problem on the here, more on here, then you can add more needles. The more needle will be Shenmen, Daling, Taiyuan. It's those 3 points. I don't remember the code number, but it's on the point of the wrist. Okay, what you can do is you can use those 3 points I just said on the point of the wrist instead of heart 5, PC 6, or lung 8. But if the pain's mainly on the stiffness neck, you needle it and they feel better, but they still get stiffness, and you add on more needle. You can add on lung 8, PC 6, and heart 5 for that. Because those are strong and make the neck even further better. Or you can straight away go, not needle anything, just get the access point around here on those 3 meridian, close to wrist and needle, and it works. Okay, here's another magical 12 that I may use. This is one strategy, and the second strategy I give you in here. We know it's a headache, right? And including the neck, right? So anything from here to here, you do a 12 magical point. Or you can do just in here, needle here for local balance. What local balance? 3 general point for the young meridian, and here the 5 neck point. You put 5 neck point for the neck, okay, and you put the joint point that good for migraine and headache. So this is thumb side, this is the little finger side. On the index fingers, on this joint, the first joint from here to here, the first joint, the second joint, the first joint of your index fingers, needle on the thumb side. The middle joint, middle finger, needle here, the first joint on the thumb side. And the ring finger, the first joint on the thumb side. Okay, and the little fingers, needle here on the little finger side. Okay, this point treat the forehead. This point treat the top. This point treat the side. This point treat the back. And it makes sense. Why is that? This point treat the forehead because the stomach meridian. This is the stomach meridian, large intestine meridian came out. At this point over here, closer to what? Spleen, PC. PC can treat imbalance liver, and liver meridian inside it come to the top to Bai Hui. Okay, we call Dian Ding, the top in. And this one is Sanjiao, right? Sanjiao can balance GB, and Sanjiao and GB meridian on the side, so they treat the side. And this one, on what meridian? Small intestine. So small intestine meridian can treat UB, and UB meridian come to the back. That's why I can treat the back. So those 4 points can treat. So 1, 2, 3, 4 headache. You can do all the Jingwao point on the young headache, or you can treat the yin as well, good for headache. And you can put over here for the neck. Okay, then you can put any point in here, 1, He Gu, and Sanjiao 3 and Sanjiao 2, you can do that too. And large intestine 2 and 3, you know, you can do 2 and 3. This is a local balance. You can do this. On the other hand, you can do a 12 magical point from here to here. How to do that? Jingwao point in here, and the other you put in meridian of the joint. And when you come to the leg, you put needle on over here on the young meridian, and in meridian over here on the ankle. Right. This is 12 magical magical 12 strategy just from here to here. You know, the first strategy I give you, magical 12, is from here, needle here to here, right? Because this here, it can represent the whole head. But this here, it can represent the whole head too. So depending which one do you want to do, and every of them working. If one of them is not working, then you do the other one, you know. So you make the call. Okay. So the main thing for when it comes to acupuncture, don't just think. You know, keep thinking, will this work? Will this work? No thinking with your patient. Do it. Action. Do it, and your patient will let you know whether it works or not. Not just keep it in there and say, oh, will this work? Will this work? No. Do it straight away. right? Take action. Don't think too much. Thinking won't get you anywhere. Thinking you won't get your patient better. You have the strategy, good enough. Do it straight away. If this doesn't work, change to the other strategy. So needle it and try it out. If you stop in there and keep thinking, oh, Szenan give you 3 different strategies. Which one's better? Which one's best? A lot of people ask me, which strategy is best for headache? Which strategy is best for lower back? I don't know. I have a lot of strategy. But if I give you what I think is best, it may not suit you. It may not suit your patient. So instead of finding out which is best, when I give you a strategy, a few of them, just do it. Do it and you know which one works, which one not. And you have to gain your own experience to find out how it works, what patient works, what patient doesn't work, who doesn't work, who works. Does it make sense to you? If it comes to, you can go any point from here to here. It doesn't need to be the acupuncture point. You can go for RC point. Or even though you don't have to go for RC point, because this is to present the whole head. You needle it, it will work. When I say you needle the joint over here, can I not needle the joint here and needle the furthest joint over here? Yes, you can. If I needle here, 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 it works. Can I go ahead and needle here, 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 here? Yes, you can. It still represents the whole head. If this one works, that's great. If the patient still has pain, you want to keep on the strategy with local balance. You can put Jingao point, you can put this point, this point, this point, and this point. Or you can go ahead when after this, you do this magical 12 strategy, which means you can do needles, Jingwao point on the first part, or you can do this. They all work. But which one's better for your patient? I don't know. You try it and you know it. Some patients work better on this. Some patients work better on Jingwao point. Sometimes I just use both. Combine together. You don't have to think, oh, which one's better? Which one? No. They're all working. If they're all working, put them all. Simple. Right? That's it for today. It's supposed to be just for half an hour, but we go through about an hour. This is the long one. Okay, that's because we talk about a lot of the side effect of the drugs. Is important. It took more time for that because I want to bring the awareness for all the acupuncturists and the patient to know about the side effect of the drugs. Because once you know it, you have the knowledge, you have the information. Then every patient come, you need to check the side effect of the drug, not just with my migraine. Okay, this is so important. I do it all the time. So, and I bring the patient and let the patient know what's going on with the drugs, and they need to know that because no one has ever tell them the side effects of the drug. If you are the first one, you gain the trust from the patient. You have the knowledge. This is important. Ask yourself, how many of you tell your patient the side effect of the drugs, but they are taking it for years and they have side effects? And you know it. We keep talking about side effects, but no one clearly tell them the side effect, and they know it as well. And we just ignore them and keep letting our patient take those drugs. Right? And I'm not there to ask my patient stop the medication. I bring the awareness, give them information, and ask them to find out more. Right? If we found any of the medication side effect that affect our acupuncture strategy or bring slow down to bring the acupuncture function properly, then we need to tell the patient. We need to tell the patient, and the patient need to know that. Stay awesome. Have a great day. And are you all finding this help? Letting me know whether this live video helping you or not. Comment down there. Let me know. Does it help you at all? Does it help you at all? Do this strategy, have you ever used this strategy at all? Okay. And what is your opinion of the side effect of drugs? Have you ever used the side effect of drugs to discuss with your patient? And have you ever used the strategy that I just showed you on your patient? If you do, let me know how effective. If you haven't, that's fine. Keep going while you try it. While you try this strategy on your patient. Now, if yes, again, don't think too much. Which one's better? Just choose one and work on it. Then when it works, please come back and comment down there and let me know whether it works well or it doesn't work well. When it doesn't work well, hey, no one strategy can work for everyone. That's why we have a lot of backup strategy. We have a lot of other strategy. That's why I learn a lot, because I try to help all my patients, not just one, not just 5 out of 10. If one strategy can heal 5 people, then you need to find out the rest of the strategy to fix the other 5. People said, well, if you have a strategy, one thing it worked for 5 people or 8 people, that's good enough, and you stop there. No, that's not me. I want to find out the others strategy that to fix the other 5 or the other 2 patients, because I really want to help all patients, not just 1 or 2. If patients don't get better, I feel bad. I really feel bad. If that is because of my strategy, my knowledge, my technique are not good enough, then I feel bad. That's what pushing me keep learning. Okay, I hope you are the same. Thank you very much and stay awesome, and I love you all. I'll see you tomorrow. Let me turn it on. Hi, Allah Lee. Thank you for joining us. Thank you, Bruce. I didn't realize you're here because I have 4 different platforms, and I was checking here, I didn't see you, and now I just about finished everything and I saw you in this platform. But thank you for comment down there. Thank you very much.